Imagine your best friend passing away from cervical cancer, a very treatable cancer if caught on time. Now envision you have a daughter, a dedicated urogynecologist who spent years studying, thinking of all the ways she could help women, only to find herself in a system where those women had to wait 3 years or more to get the care they need. Now imagine you're in your late 50s with issues of your own that took years to get diagnosed. Well, ladies and gentlemen, that's a recipe for a pissed off menopausal woman if I've ever heard one, and you're looking at her.
And so our journey began. We had no money, we had no plan, but we had passion and we had a mission.
That's right.
So, and as divine intervention would have it, after all this had happened, I was on a group trip to Vietnam. And during that trip, I happened to sit beside one of the folks who I'd been traveling with, a gentleman. We were just chatting at lunch, and I said, "Oh, and what do you do?" And he said, "I'm a gynecologist at the Dartmouth General Hospital." I said, "That's amazing, because my friend and I, Sheri, we're really trying to do something to maybe move the needle in women's gynecological health, but we're not really sure how we can help." And he said, "Well, funny you should say that. I'm trying to build a pelvic health suite. I've seen them in other parts of the world, across the country, but I think we could use one in our region, and we don't have one." And I'm just like, "What? Can you meet with my friend the minute, when we get back to Halifax, whenever you're free? I know you're doing busy work, but when you have a minute, could we meet?" The plane touches down in Halifax. I get a text, literally, 5 minutes later. "Yeah, I can meet you on Tuesday." So Sheri and I went over and met with Dr. Maudsley, who was the gynecologist I'd met on this trip. And then he invited Stephen Harding and Carolyn Marshall from the foundation, the Dartmouth General Foundation, to join us for this meeting. And from that moment, they took us under their wing, and they, together with our donors and our supporters, we ended up building that freaking public health suite, the pelvic health suite in the Dartmouth General, and we feel changing the landscape for women's health care. Yeah. That's how it all began.
We wouldn't be where we are today without the Dartmouth General Hospital Foundation. We always say to each other, what would the Dartmouth General do?
Literally.
Number one, they believed in us. And number two, they supported us in every way. They involved the doctors, whom we got to know well, and hear from them how the suite would impact their patients. We could see the spark in their eyes of how much their delivery of care would be impacted. They taught us how to lead by putting our donors first. Our donors were celebrated on 3 different occasions, and their names were placed on the very impressive donor wall. Fundraising initiatives will get their applause, but you always lead from behind. After all, it's the donors that are truly making the difference.
In 3 years, we have raised $3.2 million. Year 1, of course, was the Deanne Reeve Pelvic Health Suite. That's how we began. Year 2, we were able to purchase some much-needed gynecological equipment and technology for the IWK, for their gynecology department. And this year, year 3, we are bringing the rock star of surgical robots, the Da Vinci Xi, to the QE2 Health Sciences Center. Oh, actually?
This just in. It's been delivered.
Amazing. So the Dartmouth General was really the catalyst for all of this. And this is the cool thing. They continue to support us no matter what hospital we're working with, because they know they're promoting us from behind, knowing that what we are doing is for the greater good, for all of us. And we cannot thank them enough. They are truly authentic leaders.
Yes. We started this in memory of our dear friend Deanne Reeve, who passed far too early from a late diagnosis of cervical cancer. Her passing left a huge void, but it also sparked a determination that no woman in our province should go without the absolute best care possible. It's in her memory that we are continuing this work to ensure that not only we get better equipment and technology, but also so that that technology will attract and retain world-class physicians, ensuring the best care stays right here at home in Nova Scotia. Just last week, we created and hosted the first ever Atlantic Menopause Show, where that same spirit continued. Through learning, connection, and empowerment, we are normalizing the conversation, advancing care, and celebrating the strength of women through every stage of life.
I mean, imagine 700 women, all at the Halifax Convention Center. There was one man, bless his soul.
Yep.
And they all felt validated and heard. It was mind-blowing to us because we don't work in the space, but we were working with healthcare professionals who helped us bring this together, and we were blown away. And the committee worked so hard to make sure that we created this space where we had education to spark change. So that for us was so big. And we hope that tonight leaves you feeling informed and inspired and also reminded that women's health deserves our voices, it deserves our attention, and it deserves innovation at every age and at every stage. So next year, because we're still on the go, and for the following 5 years in conjunction with the QE2 Health Sciences Centre, the Nova Scotia Health Authority, and Nova Scotia Health Innovation, we are pleased to announce that we are building a women's gynecological health hub focusing on the latest technology in diagnostics and treatments. This is our vision, and we're going to make that happen. And not just to improve women's healthcare treatment, of course, that is how we began, but to have the tools and the support so Nova Scotia is known globally as the place where women's health practitioners want to come work and want to come live. Yes. Come on down.
We have learned that having physicians involved in this process in a meaningful way is absolutely key to successful fundraising. There is nothing more impactful to donors than hearing from physicians how much the initiative will impact their delivery of care. So the next time you're asked to speak and share your story, please do it. Just this year, we had a gynecologist speak at an event, and she got choked up because she was so thrilled some people were finally advocating for her. That speech brought us a $1 million donor.
Thank you. We welcome you all to be a part of this growing movement and to make women's health viable, to make it vibrant, and to make it valued. So on behalf of the Orchid Women's Health Initiative and the first ever Atlantic Menopause Show, we want to thank the folks from the Dartmouth General Hospital Foundation team for their outstanding leadership and for allowing us, just mere mortals, the opportunity to work together to improve women's health outcomes right here in Nova Scotia. Thank you.